I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. COVID-19 has changed the way we interact in all kinds of situations. How has it affected our sex lives? This is the People's Pharmacy with Terry and Joe Graydon.
During the pandemic, we're not even supposed to shake hands, much less hug or kiss.
Are there ways to have safer sex even during a pandemic? What about sexually transmitted diseases? Is there any way to test yourself at home?
We've all heard about contact tracing for COVID-19. This public health tactic was developed to help in the control of sexually transmitted infections. How does it work?
Coming up on the People's Pharmacy, safer sex in the time of COVID-19.
In the People's Pharmacy Health Headlines, there's been a lot of bad news this week about the spread of COVID-19 in the U.S. and internationally. More than 50 million people have been infected worldwide in the course of this pandemic, and over 1 million have died. But there is a glimmer of hope. Pfizer announced this week that its vaccine has preliminary evidence of high effectiveness. However, only the Data Safety Monitoring Board knows how many of the 94 people who caught COVID while participating in the trial received the vaccine and how many were on placebo. Until the study is completed and the data are released, we won't know how effective the Pfizer vaccine truly is.
The FDA gave Eli Lilly's monoclonal antibody treatment a green light for emergency use authorization. The drug, bamlanivimab, is similar to the intravenous drug President Trump received while in the hospital. It's intended for high-risk patients before they develop complications of COVID. The earlier they get the drug, the better it works. The pandemic is far from over, but these developments offer some optimism that we will overcome it.
Until there's widespread access to vaccines and treatments, people still need to do their best to avoid catching the coronavirus. A new study published in the journal Nature shows which places are most closely associated with its spread. Capping occupancy in some of these spots, particularly restaurants, cafes, gyms, and religious establishments, could greatly reduce infections. This conclusion comes from tracking the mobile phones of millions of Americans during the first wave of infection. Based on the analysis, if the riskiest venues capped capacity at 20%, it could reduce the spread of infection by perhaps as much as 80%.
27 years ago, a study published in the New England Journal of Medicine reported that incorporating moderate quantities of walnuts into the diet could lower cholesterol levels. The authors called for further study into the long-term effects of walnut consumption. This week, a study published in the Journal of the American College of Cardiology reports that people who eat walnuts have reduced inflammatory markers in the bloodstream. The study, called WAHA, stands for Walnuts and Healthy Aging. 634 volunteers completed the 2-year randomized controlled trial. The experiment compared a standard diet with no walnuts to a diet containing 1 to 2 ounces of walnuts a day. At the end of the study, several inflammatory markers were lower among the walnut eaters. This reinforces epidemiological data suggesting that people who eat nuts, especially walnuts, are less likely to develop cardiovascular disease or die from heart attacks.
Olive oil is another food with a reputation for fighting inflammation. Greek scientists have reported on a study comparing the effects of a regular Mediterranean diet to a diet supplemented with 2 different types of olive oil. One randomly assigned group of elders got an early harvest extra virgin olive oil rich in phenolic compounds. Another got olive oil with moderate rather than high levels of phenolic compounds, while the third group had no olive oil supplementation. All of the volunteers started the study with mild cognitive impairment and completed cognitive tests before and after the year-long study. The results of these tests showed that the participants consuming high phenol early harvest olive oil performed better than the other groups on almost all measures. The group that did not get supplemental olive oil had declines or no improvement on test scores, while the group using moderate phenol olive oil did significantly better. The significant improvement in cognitive function among volunteers getting olive oil was independent of the gene ApoE4, which affects people's risk of Alzheimer's disease.
This week at the American Heart Association Scientific Sessions, researchers will present data suggesting that people who regularly consume chili peppers may live longer. The scientists analyzed more than 4,000 studies involving nearly 600,000 individuals. Relative risk reductions of death for people who eat hot peppers were 26% for cardiovascular disease and 23% for cancer. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Are you feeling isolated because of the coronavirus pandemic? Lots of people are getting fed up with social distancing, but cases are climbing. At last count, more than 10 million Americans have been infected with COVID, and more than 240,000 have died. Public health authorities urge caution when out in public. Avoiding close contact has been especially hard on young adults of dating age.
Today, we're talking about sex in the time of COVID. As a result, we should warn listeners, Terry, that this show might not be for everyone. It contains frank discussions of sexuality, sexually transmitted diseases, relationships, and dating in plain language that could be challenging, especially for younger children.
If it's not appropriate for your family to listen right now, you can catch up later on the podcast. You can find it through your favorite podcast provider or listen to streaming audio on peoplespharmacy.com after the weekend. How can people approach sexual encounters more safely? How has being stuck at home affected long-term relationships? And how does a public health approach to sexually transmitted infections inform the methods public health authorities are using to try to contain COVID-19?
To find out, we turn to Dr. Ina Park. She is an associate professor in the Department of Family and Community Medicine at the University of California, San Francisco School of Medicine. Dr. Park is medical director of the California Prevention Training Center and author of the forthcoming book, Strange Bedfellows: Adventures in the Science and Surprising Secrets of STDs. It will be out in February 2021.
Welcome to the People's Pharmacy, Dr. Ina Park.
Thanks. I'm really happy to be here with you today.
Dr. Park, we're living in odd times. COVID-19 has created conditions where people aren't supposed to get close to one another. And I think all of us are missing human touch, hugs, handshakes, not to mention intimate relationships. Now, people with partners are presumably pretty lucky, and we'll talk about that in a minute. But what about everybody else?
Well, as you mentioned, this is a very, very difficult time in terms of folks who didn't have a primary partner for sex to begin with are sort of stuck either not having sex at all or having solo sex or having to take some level of risk to find a new partner. And I think we know, though, that, understanding human nature, that sex is a need that most people have. And therefore, I think what people are doing is, in the beginning, probably did spend some time social and sexual distancing. But as that quarantine fatigue sets in, I think people are starting to branch out and become sexually active again. And that, of course, comes with some risk.
Absolutely. And we're going to talk about that. I ran across a mention in my Twitter feed the other day, a mention of Tinder, which was not a topic I've actually spent a lot of time thinking about, but there it was. And this person was saying, well, I went to, I opened Tinder and then I sort of slapped my own wrists. So people are having complicated relationships psychologically with the idea of sex the way they used to do it. Mm-hmm. What can they do now?
Well, maybe first you should tell our listeners what Tinder is.
Sure. Tinder is one of what we would call in our business a geosocial or geosexual networking app. And that really allows you to look for potential, dates or sexual partners within a certain geographic radius. And there's many, many different apps out there. Tinder is one of the most popular, and it's, not only directed at heterosexual folks, but I would say, a lot of folks who use the app are heterosexual. Then there are also apps that are targeted more towards folks who are LGBTQ plus, but there are folks of all stripes on Tinder. And, at the beginning of the shelter in place, the number of folks who were engaging on Tinder went way up. And in fact, they had about 3 billion swipes on their app on March 29th. And a swipe just means like when you're looking at somebody's profile, if you want to engage with them, you either swipe left or right, depending on whether or not you're interested.
And so people were very interested all of a sudden.
Right. I mean, I think people, were very interested, but the way that they were engaging was primarily, doing these sort of in the app, you can message people and you can do video chat and that kind of thing. And I think the virtual date, type of platform is what was sort of expanding there. I don't know that people were necessarily meeting more in person because of that.
Right. And as you've pointed out, it's been many months now that we have been supposed to practice distance. It's
Right.
really hard. It's really hard to date someone if you're not supposed to get any closer than 6 feet. How do people do it?
Yeah, I mean, right now, so I work in a sexually transmitted infection clinic as well. And I can just tell you that people held out. My patients were able to hold out for 4 or 5 months. And then many of them said that they just kind of are biting the bullet and taking their chances and just reducing the number of folks that they might, engage with for an in-person date and spending a lot more time actually engaging through video chat first and then establishing whether or not they actually want to meet in person. Whereas in the beginning, pre-pandemic, you would like somebody, like the way they look, and immediately arrange to meet in person. So I think that there's a longer lead-in time with virtual interaction before people are actually meeting in person. But I'm here to tell you, they are still meeting in person and they are still having sex.
Well, humans are humans, and
Yes.
humans are animals, and animals like to have sex.
Right. And so do we.
Absolutely.
Well, now, what about people who are in stable relationships?
Mm-hmm.
What about romance? There, no more evenings out, dinners, going to the theater. How do you create excitement in a stable relationship in a time of COVID-19?
Oh, I mean, I certainly could use advice on this in my own life, but I think, the things that I've read in terms of how people are managing this is including, trying to find childcare, or if kids are old enough, leaving them and then actually the couple actually going out and doing something sort of outside, where you can actually, not necessarily go out to dinner, but you can actually, go outside and do something together. You have to be very intentional, I think, about creating the time together. I have some folks in my life who paid the kids money to go to bed early and put themselves to bed. Then they locked themselves in a room and, just watched a movie together without their children. But you have so many fewer opportunities to create those alone moments, I think, when everybody is together working and schooling in the same household. I think it's been really challenging and put a lot of strain on relationships too, because of the inability to distance, if you happen to have children. and just to have space from each other, which you might normally organically have if at least one person was going to an office during the day.
Absolutely. And of course, it's far more difficult for parents of young children to get a babysitter. You can't just have a babysitter come in from,
That's right.
down the street.
Right. Those who had a trusted individual who might be in their pod, are okay. But people who might have used one of the online services, of which there are many, I think are really stuck in terms of trying to figure out whether or not they're willing to take on the risk of bringing in an unknown individual into their household, which is not, recommended.
Well, there's another issue as well, and that is, dare I call it, stress, anxiety, depression. I mean, after 3 or 4 months, people were like, okay, enough of this already. And then after 6 months, it was like, I've had it with this. And now it's like, this is just weighing me down. It's hard to be sexy when you're feeling down.
Absolutely. And can I tell you, I've seen this go in both directions. So there's what you're describing, which is people are home, they're not getting dressed up, they're not doing their hair, they're not showering. I mean, it just is a very unsexy type of setting. Do you know what I mean? And then I have other people who, instead of stress baking, they're actually having more sex than they did pre-pandemic because this is the way that they're relieving stress. But I would say, based on what I've seen among my patients and just in my own personal life, is that most people are trending towards this direction of having increased mental distress and anxiety and feeling less sexy than they did pre-pandemic.
So what are you telling them?
I mean, I don't have great advice for that, unfortunately. I mean, I'll tell you what some patients have done, which I, think is, probably a good harm reduction strategy, is that they're getting more creative in terms of things like video, like video sex and online sex in that regard. So just trying to come up with some ways to introduce variety into their routine. But many folks I know just decreased their sexual activity when they were just so stressed and overwhelmed and frightened about how to live with this virus. I mean, I think, as human beings, our sexual desire will bounce back, and we're learning how to live with this virus and how to exist with this virus. But I'm telling you, it's just a challenge, and I don't have a good answer for how to get us to feel sexy again.
You're listening to Dr. Ina Park, Associate Professor in the Department of Family and Community Medicine at the University of California, San Francisco School of Medicine. Dr. Park is Medical Director of the California Prevention Training Center and author of the forthcoming book, Strange Bedfellows: Adventures in the Science and Surprising Secrets of STDs.
After the break, we'll learn how negotiating safer sex is similar to setting up social interactions in a time of COVID. How careful is everyone being?
Have sexually transmitted infections become less common while people are practicing social distancing for COVID-19?
Some people haven't been tested because clinics are less available. If you don't know you're infected with an STI, you can't get treated. What are the consequences?
Is it possible to do home tests for sexually transmitted infections?
One drawback to home testing is no contact tracing. Why is that so important?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This People's Pharmacy podcast is supported in part by CocoVia with a special offer on heart-healthy products. Starting on Monday, November 16th through Sunday, November 22nd, People's Pharmacy listeners can get 25% off on the heart health products.
The heart health supplements contain 450 milligrams of cocoa flavanols, plant-based nutrients from natural cocoa. Taking these flavanols daily supports cardiovascular health.
To take advantage of this special holiday offer, use the code CV25 when you check out. Even already discounted products like subscription and 3- and 6-month options are on sale.
The unflavored dark chocolate drink mix is a great heart-healthy alternative to hot cocoa. It has no sugar and only 20 calories, so you can indulge with no guilt at all. The code for this special offer is CV25. Learn more at cocovia.com.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by CocoVia Memory Plus, a cocoflavanol supplement backed by 4 clinical studies that show significant improvement in 3 different aspects of memory. More information at cocovia.com.
Also by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome, now with an annual health club plan. Online at verisana.com/health-club.
Today, we are talking about a sensitive topic, sex in the time of COVID-19. Negotiating intimate interactions is challenging in the best of times. During a pandemic, however, it's even more difficult, and the stakes are higher.
If you're just tuning in, we need to alert you that this interview may not be appropriate for all listeners. We're talking frankly about sexuality, relationships, dating, and sexually transmitted infections. There's some language that's not appropriate for younger children. If you don't wish to listen at this moment, you can listen later to the podcast at your convenience.
We're talking with Dr. Ina Park, Associate Professor in the Department of Family and Community Medicine at the University of California, San Francisco School of Medicine. Dr. Park is Medical Director of the California Prevention Training Center and author of the forthcoming book, Strange Bedfellows: Adventures in the Science and Surprising Secrets of STDs.
Dr. Ina Park, I came across an interview in which you and a few other experts were discussing the idea of negotiating risk with people in your pod and people outside your pod, and, how close do you get? Can you have a picnic with another family? And you pointed out that this is very much like negotiating before a sexual encounter. Can you tell us a little bit more about that, please?
Sure. Yes, that piece we did for NPR for Weekend Edition. And one of the things that I noticed was, discussing socializing and what folks are comfortable with and what they're not comfortable with, and how far they're willing to go, what they're willing to do is really similar to these sort of sometimes awkward safer sex conversations that, we've had to have, what are you into? Are we going to wear condoms or not? Are we in an exclusive relationship or not? So I saw lots of parallels there. And so you're having those types of conversations with people who you might have had in an intimate context, and now you're having to have them with just anybody in your larger social circle. So I found that as sort of interesting parallel in my own life.
Absolutely. I think it was quite fascinating for me to think about that. And it strikes me that if everyone were actually following the exact guidelines that we have been given for COVID-19, the rate of sexually transmitted infections, your specialty, would be dropping like a stone. Has that happened?
Well, it's interesting that you bring this up because I just contributed as an interviewee for a piece in the New York Times that was just released today by Jan Hoffman, which documents the fact that STIs are declining in the United States after they had been increasing, for the past 15 years and had hit a peak actually in 2018 and in 2019. And then now in 2020 appear to be declining. And part of that is related to this whole social and sexual distancing. But the other issue is that there's been a shutdown of many sexual health clinics all over the country due to folks being deployed to work on COVID, as well as shelter-in-place orders, and then a shortage as well nationally of the kits, the testing kits that are used to diagnose certain STDs. So we have this confluence of multiple forces actually leading to a decline in STDs for the first time.
This reminds me a little bit of influenza, because it turns out that the flu season in the southern hemisphere, and we're talking about, of course, Australia, we're talking about New Zealand, we're talking about South Africa, Chile, a lot of those countries had virtually no influenza during their winter, which was, of course, our summer. And it was like, well, how did that happen? Well, the way it happened was people were more careful. They were wearing masks, they were social distancing, and influenza not completely, but almost completely disappeared. And I'm wondering if sexually transmitted infections are likely to go down. And it sounds like, based on what you're hearing through the grapevine, that in fact they are, because people are beginning to be, or have been, much more careful.
Absolutely. And one of the things that was just presented at the CDC's STD prevention conference last month was the fact that, in the second quarter of 2020, they had expected a certain number of gonorrhea cases based on the trends that we had seen in 2019. And there was a deficit of about 60,000 less cases. So I do think that certainly this kind of distancing and, not seeing new partners and not mixing social circles is definitely contributing. But then we have, all these other factors related to the chaos of COVID that also played a role.
And what I'm hearing you say about some of those other factors is we're also not testing, and you can't find cases if you don't test. Is that right?
Absolutely. And that's why I think while I agree that absolutely distancing is playing a role in the decline, I know that we're also missing cases, because if you're simply out of kits and you can't detect the cases, then they just go on being undetected, but yet can be spread asymptomatically, much in the way of similar to COVID. STDs often are asymptomatic and can certainly be spread through asymptomatic transmission.
Well, what really worries me is that sexually transmitted infections can have very serious consequences, which I'd like you to address if they go undetected and untreated. So A, what are the problems? And B, are there ways that people can be tested at home? We're very big boosters of home testing. And we've heard that there are some STDs that can be detected with a home kit.
Absolutely. So let me start first with the first part of your question, which is, what are the downstream effects of not diagnosing and treating STIs? And I think for women, it's very clear that STIs, including gonorrhea and chlamydia, are linked to really negative health outcomes. And those include pelvic inflammatory disease, which can lead to tubal factor infertility and ectopic pregnancy, which, as you guys both know, is life-threatening. And then as well as for men, including men who have sex with men, infections with gonorrhea and chlamydia, as well as with syphilis, have been linked to an increased risk of acquiring HIV. And so when folks, especially folks who might have a rectal infection, actually have, about a 5% chance of acquiring HIV in the next year. So it just reflects, an STI reflects that the person may be engaging, in sex in high-risk networks where they might be likely to be exposed to other STIs, including HIV.
So it's kind of a marker of behavior.
It can be, yes, exactly. And it's a marker of the fact that, if you are getting multiple STIs, it's just a sign that the sexual network that you happen to be in may have a lot of, other STIs and may have HIV. So it's putting you at increased risk.
So a lot of people are probably not going to see their doctor, not going to a clinic. What can they do at home?
Yeah, exactly. So, the Kaiser Family Foundation put out a very nice sort of online Test Finder, where you can enter the state that you're living in as well as your insurance status, and tells you all of the providers online that are actually providing STI testing, as well as services such as contraception, which can also be provided safely online. And so hopefully I'll be able to send a link to you to that resource, and you might be able to share it with your listeners.
We'd really like that. We'll put it on in the description of this show.
Yeah, so there are multiple companies out there, and I won't promote one over the other, but that are offering basically home-mailed STI testing. And sometimes those kits you can take a sample at home and then you can put it back into the mail and that will get sent back to their laboratory. Results are delivered online. And then if there is a positive result that needs treatment, most of these companies have contracted with some sort of provider or physician group. And so they'll have a licensed physician who is able to then, administer treatment and sometimes have a video visit with the person, which is included as part of the service.
So what are we talking about? What kinds of sexually transmitted infections can be detected with a home kit?
So what I've seen out there is companies that are doing what we call dried blood spot testings, where you're basically pricking your own finger and collecting blood, and that's being tested for things like syphilis and HIV. There are folks who are also sending out kits to collect urine that you can test for gonorrhea and chlamydia, as well as swabs that can be used inside the vagina to test for gonorrhea, chlamydia, trichomonas, and then swabs for the throat and the rectum that can be used to test for gonorrhea and chlamydia. So that's the whole sort of complement of tests I've seen out there. Different companies are offering different things, and not everybody is offering testing at every anatomic site. So it's good to look to see exactly what you're getting before you order, of course, and also to see how they want you to return the test kits. Some folks will actually let you drop them off at a commercial laboratory near you. And then some of them actually want you to package everything up and mail it back to them. And they provide the materials for you to be able to do that.
So it actually sounds as if there's a broad array of testing capability that people can do at home. And it seems to me that this is something that people often have a hard time talking about. In other words,
absolutely.
In your business, you're trying to encourage people to presumably prevent sexually transmitted infections before they have to then go about the challenging task of treating them. But if somebody is relatively young and dating and having a hard time talking to a prospective partner about this sort of thing, it's like, well, how do we approach this testing thing? And if somebody tells me, no, I don't have anything, don't worry, be happy. Well, how can I trust what they're saying is true? Well, it sounds like this home testing thing might be a way to get around that uncomfortable questioning.
Yes, because I've thought about this quite a bit, and I think one piece of it is it's hard to initiate that conversation because STIs are stigmatized. And what I've seen some patients do and other folks that I know is if you use an online service, what they usually have is an online portal where you can see your results, and then you can just see them right on your phone. You can screenshot them. You can actually, then go ahead and text them to your prospective partner and say, see, it's all right here in writing. Here are all my negative test results. So I think it's a great mechanism for getting people tested for a condition that people might be hesitant to come in for because, they feel a little bit ashamed or they, feel that they'll be stigmatized if they're actually positive. So I love the service. The only issue is that most of these folks that are offering online testing are doing it for a, pretty high charge. And when I'm talking about that, I'm talking in the realm of $150 to $200, which is out of reach for some people. And therefore, public health departments all over the country are responding to this need by trying to stand up their own home testing programs in order to respond to this demand for folks that are lower income and might not be able to afford testing through a program online. And I think the important thing here is that we don't want costs to be the thing that's prohibiting folks from going out there and being tested.
Dr. Park, we've just been talking about testing for sexually transmitted infections. And We talked about the possibility that people could go to their local public health department and get tested at very low cost or possibly free, depending on the department. I am suspecting that if they do that and they do test positive for some infection, that then the public health department will want to do contact tracing. That's a term that most of us haven't really heard much or thought too much about until the COVID-19 pandemic, but now we have heard about it. Can you tell us, how does contact tracing work for sexually transmitted infections, and why is it important?
Sure, Terry. Well, I don't know if you realized, but the practice of contact tracing was actually born out of a necessity for controlling syphilis. So that's when the U.S. Surgeon General back in the 30s, actually, Thomas Perrin actually proposed using the concept of contact tracing. And, the idea behind contact tracing is to take a person who is dealing with an infection and try to find all the contacts upstream that may have led to the initial infection in the index patient or the original patient, and then try to find all the contacts downstream that they may have spread the infection to. So regardless of the infection, the principles are the same, and contact tracing has been used to control outbreaks of tuberculosis, hepatitis, and then, as you know, we're trying to make an attempt to do contact tracing to control COVID-19. And so, the issue with sexually transmitted diseases that is, a little bit different is just the nature of, the type of contact that led to the infection and what it means when you go and tell a contact that you might have been exposed to an STD or an STI. Because if someone is in a relationship that they think is a committed relationship, when an STI enters the picture, it obviously brings up huge issues of infidelity and trust, and people can have very strong reactions to being informed that they've potentially been exposed.
Oh, absolutely. And I'm sure that it can be quite damaging to the relationship.
Exactly. And, it's like someone's feelings can turn on a dime. I used to love you and now I want to kill you because you've exposed me to an STI because you've cheated on me. So it brings up a lot of strong feelings. It can certainly lead to fracturing of relationships. But this piece is very important because with contact tracing, which we've seen, is that if you are able to contain the chain of infection by figuring out who may have infected the patient that is in front of you, and nipping it in the bud in terms of the contacts downstream, when you get all of the potentially infected partners either quarantined or treated, then you can interrupt the transmission. And we have not successfully been able to do that for COVID-19, as you guys both know.
You're listening to Dr. Ina Park, Associate Professor in the Department of Family and Community Medicine at the University of California, San Francisco School of Medicine. Dr. Park is Medical Director of the California Prevention Training Center and author of the forthcoming book, Strange Bedfellows: Adventures in the Science and Surprising Secrets of STDs.
After the break, we'll find out about the psychological implications of a sexually transmitted infection diagnosis.
How can we use storytelling to fight STI stigma?
Dr. Park's new book is titled Strange Bedfellows: Adventures in the Science and Surprising Secrets of STDs. What are the most surprising secrets?
How can parents communicate with their children about sex, especially sexually transmitted infections?
What are Dr. Park's recommendations for safer sex during the pandemic?
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you by the Verrazana Health Club. This comprehensive home testing service enables you to track crucial health markers of gut health, inflammation, metabolism, hormones, thyroid function, and many other organ systems. Regular testing can help detect health imbalances before they lead to sickness. online at Verisana, verisana.com/health-club. Get 50% off the first month with the discount code PEOPLE50.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by Verisana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Now with an annual health club plan. Online at Verisana, that's verisana.com/health-club.
And by CocoVia, with heart-healthy cocoa flavanol products on sale starting Monday, November 16th. More information at cocovia.com and on our website in the program notes for this episode.
Today we're talking about sex. Sexually transmitted infections can be very challenging. How can we have candid conversations with our children about this sensitive topic?
Our guest is Dr. Ina Park, Associate Professor in the Department of Family and Community Medicine at the University of California, San Francisco School of Medicine.
Dr. Park, when people find out that they have a sexually transmitted infection, it can be devastating. Mm-hmm. We have received messages on our website, comments from people who say, I just tested positive for herpes. Mm-hmm. Mm-hmm. My life is over. I'm considering suicide. And it just scares us because there are infections like syphilis and gonorrhea that can be treated and cured. But there are some other things like herpes that can't actually be cured. They can be treated and treated quite successfully with antiviral medications, but the psychological impact, can you talk about that a bit, please?
Sure, Joe. And I'd actually like to share a brief story that illustrates exactly what you're talking about, which is that I was seeing a patient the other day who's HIV positive, and he had a new genital ulcer, and I diagnosed him with herpes, and he just burst out into tears, and he said, I don't know why I'm crying. I didn't even cry when I received my HIV diagnosis. And so herpes is an incredibly stigmatized condition. And the truth is that it is something that is controllable for the vast majority of people with antivirals, as well as the fact that over time, outbreaks become so infrequent that many people stop having any outbreaks altogether. But people have placed, so much weight and there's so much sort of mental anguish that goes along with the diagnosis. But in actuality, once people, get over the first year can be difficult in terms of the recurrences and outbreaks. But in terms of physical symptoms, it gets so much better over time. Now, then you have to then do the disclosure piece, which is the part that really brings people that enormous amount of anguish because they feel like they're going to be rejected from partners. And I have certainly heard of that happening. But so many people are positive for herpes. I just am trying to normalize the fact that we all get some STI at some point. And some of those are herpes, some of them are HPV, and some of them are other bacterial STIs. But the fact is that all of us are going to get something, so that we shouldn't stigmatize each other or make each other feel ashamed for having one particular, virus among the many different STIs that are out there.
Dr. Park, how do you use storytelling to fight the lingering stigma towards STIs of all varieties?
I feel like I use storytelling in multiple settings. I use it with clinicians when I'm going out and training and teaching about this to illustrate the sort of arc of these infections, especially something like herpes, and to understand, how people end up living with it and how it ends up becoming a little bit more of a nuisance and not so much of a, life-ending or life-altering situation. And by sharing those stories, I think clinicians are then better able to counsel. And then over time, they develop their own stories that they can use to sort of reassure patients and help them feel better. I also use storytelling with patients. And what I do is share stories from other patients that I've had and what they've experienced and how they've coped. And I feel like storytelling can be helpful for both, providers and patients in that regard.
Dr. Park, we're all looking forward to your forthcoming book, Strange Bedfellows, Adventures in the Science, History, and Surprising Secrets of STDs. And I would like to know, what are the most surprising secrets?
Well, I think Terry and Joe, you guys know this, but I don't know if everybody realized how universal human papillomavirus infection is, and that basically every sexually active person is going to be infected with at least one strain of the human papillomavirus if they become sexually active. So that I think might be a secret or come as a surprise to folks who are out there. I think the thing that we just talked about, which is how herpes is more stigmatized than HIV, may come as a surprise to some of your listeners and some of the people who are reading the book out there. One of the other things I talk about is syphilis and the fact that it nearly disappeared and was almost eliminated in 1999 and 2000. And now we are seeing rates of syphilis that are parallel to the early 80s before the onset of HIV/AIDS. So those are just a few. I also talk about the practice of pubic grooming and pubic hair trimming and the number of injuries that are reported. One of the things I talk about is the National Electronic Injury Surveillance System, and they reported in an 8-year time period 12,000 injuries related to people trying to shave and trim their pubic hair, and talk about how that can be actually related to skin-related STIs because people end up damaging their skin and end up making themselves more vulnerable to infections. So there's all kinds of funny stories and personal anecdotes as well as in-depth interviews with scientists. But the science is there, but I definitely lead with storytelling and humor to try to get my point across.
Well, I've got a question about what I'll call rumors, myths, and innuendo. And I remember when my mother was trying to warn me about sexually transmitted diseases when I was a child.
Many years ago.
And she said, well, there was this woman, she was a nun. And there was this guy who would sell apples on his stand in New York City. And he would always give the nun an apple that he had spit on and polished so it looked beautiful. And she caught syphilis from that apple. And, so Joey, be careful. You never know where it's lurking. And I was like, whoa, that's scary. And of course, we get lots of questions and messages from people who either believe or disbelieve you can catch something in a bathroom.
Well, from a toilet seat specifically, I'm sure there are all kinds of bathroom behaviors that can transmit sexually transmitted infections. But just sitting on a toilet seat, is that going to do it?
Absolutely not. And as you mentioned, Terry, people can get into all kinds of trouble or fun inside of bathrooms, however you want to look at it. That could certainly transmit STIs. But this whole fear of catching an STI from what we would call a fomite, right, or an object, is really unfounded. And it's something that I deal with quite a bit from patients. And it's something that providers who are listening are going to be asked if you have, physicians, nurse practitioners, or other folks listening. And I think it's good to reassure people that sexual transmission of STIs is really from skin to skin or genital to genital or genital rectal contact or oral contact, but not, really something that we should be afraid of in terms of fomite. But in terms of being afraid of touching a doorknob or sitting on a toilet, that's something I want to reassure listeners that is not a huge concern.
Now, what about Joe's mother's story, which dates back to the early 20th century, probably the 1920s? Or the 1930s, would it be possible to transmit syphilis in the way that she described?
It would be difficult because it doesn't live that well outside of the body for a long period of time, as opposed to something like hepatitis, which if you have a blood spill, there can be active hepatitis in the blood for hours. But for something like syphilis, spitting on an apple and giving it to somebody else is probably a very unlikely method. Now, if he takes that nun and gives her a deep French kiss, now we're talking about something else altogether, because certainly syphilis can be found in oral secretions. And we think that if someone had an open sore with syphilis in their mouth, that it could actually, transmit. But unless they are French kissing the nun in the apple cellar, I don't think that it's a feasible mechanism.
And we don't think that's a likely possibility. But it does it does bring up the question of how parents should communicate with their children about things sexual in general and sexually transmitted infections in particular.
Yes. Thank you so much for asking this question, Joe, because this is something that I get on my soapbox about quite a bit. And as a parent myself, one thing I want to say to parents who are listening out there is to not put pressure on oneself to have to do it as one talk. We mentioned like, oh, have you had the talk? You know what I mean? And so first of all, putting that kind of pressure on yourself to cover everything related to sex and STIs in one conversation is just going to set you up for failure. So I would like to think about it as having dozens of little talks about any individual type of topic, and STIs happen to be one of those topics in the whole realm of things that we can talk about related to sex. And what I recommend is normalizing STIs and saying that, when you choose to have sex, these infections may come along with the territory. Almost everybody is going to get one at some point. It's not something to be ashamed of. And, I want you to get tested regularly. That's the best way to take control or charge of your health. And so to frame it and normalize it as something that happens as a natural consequence of having sex, but that it's important to be proactive, take charge of your health, and go and get tested to make sure that you're not spreading it to other people.
Dr. Park, could you tell us about your son in the emergency department when he was 7 years old and why he feels no discomfort when talking about this part of life?
I just think that he's used to me talking about STIs, and he walks by and sees pictures and asks me what I'm working on. And it's just been a normal part of his existence, the topics of both sex and of STIs. And so, when he was in a car accident and we were in the emergency department and then in the intensive care unit with him, when the neurosurgeon came by to evaluate his neurologic status, he said, "Hey, have you ever had herpes? Because if you have, you should talk to my mom about it." And it was just, everybody laughed on his team. The neurosurgeon just thought it was, really amusing. He talked about STIs with the chaplain. He talked about chlamydia with the chaplain. He talked about HIV with the ICU nurse. He talked about gonorrhea with the orthopedic surgeon. And he just realized that he had such a level of comfort with it that other people did not. And that discomfort was making people laugh. And he was just milking it for everything it was worth.
Oh, how great he found a way to make himself the star, as it were, in
exactly.
an otherwise unpleasant situation.
Absolutely.
Dr. Park, we were talking about syphilis a few minutes ago, and you mentioned actually that one of the surprises that we'll find in your book is that syphilis almost went out of existence around 2000, and now it's way back up, just like it was 20 years earlier. Do we have any idea why?
So I don't have an exact answer for you, but I'll tell you about the multiple different factors that I think are coming into play. So first of all, sex, and especially unprotected sex, did go way down eventually in the early 80s as a response to, fears about the AIDS and HIV epidemics. And then, so I think in the late 90s, we had the introduction of antiretroviral therapy, which meant that AIDS was no longer a life-ending diagnosis, and people were then living longer, feeling better, and having more sex and having less fear about having unprotected sex. So I think, that's one of the factors. The second, I think, would be the rise of online dating and apps, it is so easy now for people to be able to find sexual partners online if they're looking for casual sex. And I think in the old days, we used to have to get dressed, go out to a bar, talk to somebody, bring them home. And now you can get a date and a sexual partner. You can get it as quickly as, ordering a pizza or ordering, takeout. So I think easy access to casual sex is part of it. And then as well as, I don't know if you guys are familiar with HIV pre-exposure prophylaxis, but, people are now able to take medication daily to prevent HIV. And so therefore, if you have no fear of contracting HIV, then, getting a little syphilis is not as big of a deal to people. So I think there's a lot more unprotected sex going on because folks are less afraid of HIV, which is a great thing, but it just means that there's going to be a rise in other STIs.
Dr. Park, we started our conversation today talking about COVID-19 and the various restrictions it has imposed on all of us. Do you have recommendations for safer sex during a pandemic?
So what I've been saying to people is the best thing to do, because I'm not telling people not to have sex. What I'm telling folks is that if it's possible to have a stable person or a small number of people that you're having sex with. And so I have, many patients who do have multiple partners, and, keeping the number of people that you're seeing in that way small is the other solution, as well as spacing out time in between partners. So for example, if you were to end a relationship with a partner, waiting a couple of weeks before starting a relationship with another partner would be another way to reduce the spread if you happen to be harboring the virus asymptomatically. And the New York Department of Health, as well as the San Francisco Department of Public Health, have put out guidelines to say, try a mask, make it kind of kinky. And there's lots of creative ideas, but I think reducing partners and spacing out partners is probably the best thing that you can do. And then, of course, using condoms with casual partners so that you don't end up having to deal with an STI on top of everything else.
Dr. Ina Park, thank you so much for talking with us on the People's Pharmacy today.
Terry and Joe, thank you so much for inviting me.
You've been listening to Dr. Ina Park, Associate Professor in the Department of Family and Community Medicine at the University of California, San Francisco School of Medicine. Dr. Park is Medical Director of the California Prevention Training Center and author of Strange Bedfellows, Adventures in the Science and Surprising Secrets of STDs, to be published in February 2021.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC.
The People's Pharmacy is brought to you in part by CocoVia, with heart-healthy cocoflavanol products on sale starting Monday, November 16th. More information at cocovia.com and on our website in the program notes for this episode.
If you'd like to buy a CD of today's show or any other People's Pharmacy episode, you can call 800-732-2334. Today's show is number 1235. That number again, 800-732-2334. You can also find it online at peoplespharmacy.com.
When you visit the website, you can share your thoughts about today's show. You can subscribe to our podcast through your favorite podcast provider. It's posted on our website every Monday morning.
At our website, you could sign up for our free online newsletter to get the latest news about COVID-19 and other important health stories.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.